6:43, welcome back in. All new this morning, just about all of our local schools are now officially back in session as of today. But with the new school year comes a new round of germs. Ew. Jacqueline Quinn joins us now. Never EO to you, Jackie, but we're talking about cold, flu, and of course, COVID is still out there. It's our new normal.
Allison, I think it was a good run we had in the summer, but yes, back to school, back to germs. Some people call it the back to school plague. And what may be concerning this year is that there was a late summer COVID spike. So I actually took a look at the CDC map here, and for the week ending August 17th, the latest data that they have, DC was above the national and regional trend. Now, the CDC no longer tracks cases, but what it does do is test wastewater where the virus can be detected. Experts say this is nothing that alarming. Simply, this means the virus, along with others, are traveling around. And the CDC also expects the upcoming fall and winter respiratory disease season will likely have a similar or lower number of combined peak hospitalizations due to the COVID-19 virus, influenza, and RSV compared to last season. So I spoke with a doctor who studies long-term COVID and has been looking at these recent trends.
I'm currently advising those 65 and up to get at least one RSV vaccine and then wait and see whether that's all that they'll need. The flu vaccine is an annual vaccine, and I recommend that pretty much for everyone to get their annual flu vaccine. And then COVID's quite controversial. The CDC recommends an annual COVID vaccine for those 6 months and older.
And that's why he says before you do anything, check with your individual doctor. Now, why does he make this recommendation that you just heard? Well, it could better protect you from viruses, thus minimize interruptions to work or your plans, and nobody wants to really be sick. Of course, that's a lot of vaccines to consider. And the other part of this, he says, is to keep good hygiene. That's just a healthy practice, and be aware of the potential for germs in those crowded places. Allison, wisdom, back to you.
It's so funny. And now I really do think about wearing a mask when I go out, but then how do you even navigate it? Because nobody wants to be sick. So I love those tips, Jacqueline.
And also don't forget, they always tell you about touching your face when you're out, touching door handles,
forget, like it's
shopping
easy
carts. Yeah.
to forget to
thing.
do all that.
Yeah.
But we don't want any of those illnesses. All right, Jacqueline, thank you so much. Jonathan, over to you.